And there we are live. Welcome, members. We're going to start a new policy, which is an actual roll call vote to make sure who is here and who isn't here today. So with that, I'm going to ask Melissa to take the roll. She's going to call it from her list of members.
All right.
Please respond orally by saying here or not. Oh, don't say not here, say here.
All right. Chair Pendergrass.
Here.
Vice Chair Pena-Menard.
Yeah.
Here.
Put the meeting off.
Delegate Bagnall.
Say present.
Delegate Bagnall, are you there? Not here yet.
Delegate Barron.
Here.
Delegate Belcastro.
Here.
Delegate Bandari.
Here.
Delegate Carr.
Here.
Delegate Charles.
Here.
Delegate Chisholm, I believe, is running late. Delegate Collison.
Here.
Delegate Hill.
Here.
Delegate Johnson.
Here.
Delegate Kelly.
Here.
Delegate Kerr.
Here.
Delegate Kipke.
Here.
Delegate Krebs.
Here.
Delegate Lewis.
Here.
Delegate Morgan.
Move favorable.
Delegate Riley.
Here.
Delegate Rosenberg.
Here.
Delegate Saab.
Present.
Delegate Sample Hughes. Delegate Shalega.
Seems that she's trying to connect.
And Delegate Lewis Young.
Here.
Okay, anyone who comes in late will be present. I just need them to not be present until they actually are. Okay?
Delegate
Thank you.
Bagnall, we see you.
Okay, good.
And Madam Chair, I'll be leaving in a minute. So
Would you just comment when you leave for us to know? Would you raise your hand and make sure we
allowed
note that?
or just raising hand or just to Melissa? What would you like me to do?
Any of the above? Make sure we
Okay.
get your attention and acknowledge it.
Very good.
If anyone has to leave, make sure you get our attention and acknowledge it. Okay. House Bill, we have first bill on the agenda is a withdrawal. Is there a motion to withdraw
Motion
House
to
Bill
withdraw.
1071?
Second.
All those in favor say aye. All those opposed, no. The ayes have it. That bill is withdrawn. House Bill 934, Aaron.
This bill explicitly authorizes a person in interest to appeal a denial by the Chief Medical Examiner to correct findings and conclusions on the manner of death to the Secretary of Health, who must refer the matter to the Office of Administrative Hearings. There were amendments that were adopted in the Public Health and Minority Health Disparities Subcommittee that require the Department of Health to report to HGO and Finance on or before October 1st, 2024, on the number of appeals made to the Secretary of Health when the Chief Medical Examiner denied the request of a person in interest to correct findings and conclusions on the cause and manner of death after the effective date of the bill.
Delegate Pena-Melnick.
Thank you, Chairman, and thank you, Aaron. So why is this bill introduced? House Bill 934 is intended to fix an inconsistency in a section of the health article. Under the general provisions of the article, a person of interest, such as a family member, can request a correction as to the Chief Medical Examiner's autopsy findings and conclusions. This includes the cause and manner of death in one section and excludes the manner in another section. So basically, there was a Court of Appeals opinion that said that the legislation needed to fix this because it was clearly the legislative intent to include the manner of death. There's also a Attorney General opinion that said that the legislature needed to fix it. We never fixed it. So this is what the bill is here doing to fix this is very clear. The letter from the Department of Health actually expressed some concerns regarding the number of cases that will be appealed in the fiscal note. However, the fiscal note, if you could look at page 2, the Office of Administrative Hearings stated on page 2, the advices that the bill's changes are clarifying as OHH already handles appeals for both the cause and manner of death under current law. And then it goes on to say that the number of cases that it handled was, actually, I'm looking for it in here. It was something, oh, here it goes. It says the advices that the appeals of this type have historically been very low. In fiscal 2019 and 2020, there were no such appeals. In fiscal note 2021 through February 2021, there has been one such appeal. And then it goes on to say state finances are assumed to not be materially affected based on the appeals data that we received. We had a discussion, it was wonderful, and Delegate Riley suggested the amendment that Aaron just discussed to have a reporting to see, in fact, for the next 3 years, what is that number? We discussed it, we took a vote, it was unanimous. So I moved the amendments.
Second. Good. All those in favor say aye. All those opposed, please raise your hand in the panel. I'm looking for my panel. There we go. I see one hand, Delegate Saab, Delegate
Thank you, Madam.
Morgan.
Are we
Pardon me?
voting against, is this for the vote or is this, I have a question on.
We're on, oh, well, first of all, I should have said, are there any questions or discussions? Is that why you have your hand up? We're on
Yeah.
the amendment.
I'm just trying to figure out what the bill does now, and I still trying to figure out why we need. I remember when they first testified on the bill was like to pay for the appeal and who pays for the appeal. So with the amendment, can someone just explain real quick what the bill will do now and why do we still need it?
I'll tell you what, the amendment is what we'll talk about now. And what the amendment does is it requires a report once a year for 3 years. Is that correct, Delegate Peña-Melnick?
Yes.
So that's what we're voting on now. You can ask about the bill when we're done with the amendment, if that suits.
Okay, I will. Thank you.
Okay. Is there any discussion of the amendment? I see no hands on that. All in favor say aye. All those opposed, no. Please raise your hand. The amendment passes unanimously. You want to move the bill as amended?
I move the bill as amended, Chairman.
Second.
Delegate Saab will start the discussion.
Thank you, Madam Chairman. So as amended, what is the bill? What does the bill do now?
So do you want to go ahead, Aaron? Okay, so basically current law.
Aaron, wait, Aaron's muted.
Oh, okay,
I'm sorry. Okay.
go ahead.
No, I'm good. The bill as introduced, it's actually a clarifying bill. So under current law, a person in interest can request the medical examiner to correct their findings and conclusions on a manner of death. So they can request that within 60 days of the finding. That's current law. Current law also authorizes a person in interest, if they're unsatisfied with that denial of the request, to appeal, but only on the denial of the cause of death, not the manner of death. And there's been the Attorney General, when they reviewed that legislation that passed in 1992, found that the words "and manner" were inadvertently left out. And that went against the legislative history, the legislative intent of this bill. So this bill is actually something that was requested to be done by the Attorney General back in 1993. And also the Office of the Administrative Hearings, they already interpret this law to apply to, they already take appeals based on the manner of death because that's the way they interpret this law.
So basically this bill, thank you, Aaron, will make it consistent to what the practice is.
Okay, thank you. Thank you.
My pleasure.
Any other discussion? Okay, Delegate Saab, would you take your hand down so Melissa doesn't have to do one more thing? Thank you. No more discussion. The bill was moved and seconded. Is there any discussion? I mean, all those in favor say aye. All those opposed, no. Raise your hand, please. The bill appears to be passing unanimously. The bill passes unanimously.
I would like to just thank Delegate Riley for her amendment. Thank you.
Thank you for accepting it. Madam Chair, I don't know. I know Delegate Shalega has been trying to get in and keeps getting kicked off. Do we know if she's in yet? I told her.
She keeps popping in and out. I resent her the link. I'm worried it might be her internet.
Oh, okay. All right. Thank you.
I love to block calls. House Bill, or sorry, Senate Bill, it is House Bill 1003. And this bill, we are second. We're jointly assigned with appropriations. And with that, I'm going to turn it over to Tyler.
House Bill 1003, as amended, is shown in the reprint that was attached with the email with the voting list. The bill provides that a procurement unit must notify the Legislative Policy Committee of any emergency procurements within 72 hours of the contract either being executed or the funds being spent. The Legislative Policy Committee may request the Office of Legislative Audits to review any of the emergency procurements from that first bullet. If the governor suspends any laws or regulations during an emergency, then the governor shall inform the Legislative Policy Committee or AELR of the suspension as appropriate within 72 hours of suspending that law or regulation. And then the bill provides that the governor may not suspend any of the reporting requirements provided for in this bill.
Okay, I know it didn't go to subcommittee. Did Delegate Rosenberg want to say anything?
Yes, I do.
Please.
Thank you, Madam Chair. According to the fiscal note, the revised fiscal note for the Senate crossfile, this bill does not limit the executive branch's abilities or procedures to make procurements in an emergency. It only requires more frequent notification to the General Assembly. So thus it is basically a transparency bill. Thank you.
Would you like to move the bill?
I would move the bill.
Second.
Okay. Is there discussion on this bill? I see no hands raised. All those in favor say aye. All those opposed, no. Please raise your hand. The bill passes unanimously and will now go to the Senate because they have custody of the bill. We're just second.
No.
Did you want to add something?
It doesn't go to, it's a House bill. It will go to the floor, I believe, if appropriations is.
Well, yeah. Did I say, I thought I said it would go to appropriations. Did I say that wrong?
You said to the Senate.
No, it'll go to the Appropriations Committee and they'll send it to the floor. Right. It will not be our bill on the floor. Thank you for that. All right. Senate Bill 3. Lisa. Is Delegate Shalega in while we're waiting for her? Did she get in?
She's still not here.
Okay.
So this is a cross-file to Delegate Pena-Melnick's telehealth bill. The bills are similar, but there are a few differences that you can find in the amendments. The differences strike language that would have prohibited Medicaid or a carrier from requiring a recipient of Medicaid or an insured patient to use telehealth in lieu of in-person service delivery, and instead prohibit the exclusion from coverage or denial of coverage for a behavioral health service when provided in person solely because the service may also be provided through a covered telehealth benefit. The amendments require coverage for telehealth services regardless of the location of the patient. They require MDH to revise regulations regarding telehealth reimbursed by Medicaid to be consistent with federal parity requirements by October 1st, 2021. They require the Maryland Insurance Administration to study network adequacy and patient choice and to consider the requirements of the bill when proposing revisions to the network adequacy regulations. And then the amendments also make some conforming changes to the House bill.
Madam Chair.
Delegate Cullison.
Thank you, Madam Chair. This, as you recall, when we passed House Bill 123, we came from the perspective of we wanted to study the current utilization under the state of emergency, and then what the utilization and value of telehealth was after the state of emergency, gather enough information so that we could make informed policy going forward in 2023. The Senate bill took a slightly different approach in that they wanted that information plus more information about the relationship between telehealth and network adequacy and parity with respect to different kinds of services available to patients and also patient choice. We worked closely with the Senate, the Senate Finance Committee members to find a way to meet both of those needs. And I believe that both of these needs, the committee, and I believe that both of those needs are met, both of those perspectives are met, and the bill passed the subcommittee almost unanimously.
Okay. You want to move the amendments?
Move the amendments.
Second.
Good. Is there discussion on the amendments? Seeing, oh, Delegate Krebs.
And I'm sorry, I'm on the subcommittee, and I think we had a really good bill that we put out, and maybe theirs enhances it. And I just want to make sure, and I trust my subcommittee chair, that you believe that the intentions that we had in the bill have been maintained. And we run through this so fast in subcommittee, and I just don't want to mess up what we did. We spent so much good time, I think, putting out a great product. You feel certain that we kept what we were trying to do?
Absolutely, Delegate. I feel very confident that any language changes are only enhance the intent that we had in House Bill 123.
Because I thought we did a good job. Okay, thank you.
We did a good job.
You did a good job, all of the members of that committee. That was really and also the vice chairman over the course of the interim. I mean, there's an enormous amount of work that was done, and I really appreciate that. And
I have a
appreciate
folder that's an inch and a
flexibility.
half thick. That's
What are you going to do with that tomorrow, Delegate Krebs?
going to sleep with it and remember what we did, all the work we did. I'm not going to have a bonfire.
Okay, all those in favor say aye. All those opposed, no.
Move the bill as
Hand.
amended.
Okay, right. Good job. All those in favor of the bill as amended, say aye. All those opposed, no. Please raise your hand. I see no hands, but I was told it didn't quite pass unanimously.
I believe there was one vote outstanding, but
I see no hands.
My counsel's saying no, it was unanimous in subcommittee.
Okay, well,
I
it
guess
is
it was the
unanimous.
other bill that happened on.
All right, it was unanimous in committee.
Right.
Senate Bill 52. Aaron.
There is an amendment that would reinsert the preamble into this bill. And with that amendment, it is identical to the cross-file as it passed this committee.
Was that in Delegate Penny-Melnick's subcommittee?
Yes, and I move the amendment. So it can conform to the House bill.
Did I hear a second?
Second.
Any discussion? All those in favor say aye. All those opposed, no. Please raise your hands. I've got Delegate Krebs, Delegate Riley. This is on the amendment, which is fine. Delegate Saab, Delegate Kipke, Delegate Morgan. So I have 5 no on the amendment. You
I
want to
move the bill.
Is
Yes.
there a second?
Second.
Thank you.
and take your hands down unless you want to talk. We're not, I need to clear the panel. Okay. Is there discussion on this bill? I see Delegate Saab's hand. Delegate Saab.
No, I think there's a delay. I'm good.
Delegate Krebs, I see
Krebs
your,
has her hand up.
Delegate Krebs, you have your hand up.
Yeah, I do. I just want to remind everybody, I mean, I think the bill is fine. The preamble is very offensive to me. And I'm disappointed that it went back in, and I don't think it's necessary. Our committee usually doesn't do preambles. And so the bill itself, I think is fine, but I am just really, I'm getting really frustrated at these preambles, and I take it very personally. So I'm voting against the bill, and maybe somebody will realize that we have feelings about these things too. And I take offense to some of this stuff. So my no vote is about the preamble, not the contents of the bill. And,
Okay. Anyone else want to say anything?
Can someone just confirm for me what bill? I don't have.
We are on the,
Senate Bill 52.
yeah, Maryland Commission on Health Equity. Okay. So all those in favor say aye. All those opposed, no. Please raise your hand. I have Delegate Krebs, Delegate Kipke, Delegate Riley. I have 3 noes, 4 noes. Delegate Saab, Delegate Morgan. I have 5 noes. The bill passes with 5 no votes. Senate Bill 61, Tyler.
Senate Bill 61 is identical to House Bill 321 as it passed the House.
Move the bill.
Second.
Discussion? Delegate Kipke or Morgan, do you have a question on this bill? Delegate Morgan, your hand is up. Your hand is down. All those in favor say aye. All those opposed, no. The ayes have it. I see no hands in the panel. Therefore, the bill passes unanimously. Senate Bill 96, Aaron?
Senate Bill 96 specifies that regulations adopted by the Behavioral Health Administration must require a behavioral health program to establish and implement a safety plan for the safety of the individuals served by the program as part of the requirements for licensure. If a behavioral health program is required to adopt a community relations plan as part of its accreditation, the program must submit the plan to the Behavioral Health Administration. The Department of Health, before approving the operation of a facility or granting a license, must require a facility to establish and implement a safety plan, and if required by the facility's accreditation organization, to establish and implement a community relations plan. There are no amendments, and this was in the Public Health and Minority Health Disparities Subcommittee.
Delegate Penny-Melnick.
Thank you. We discussed this bill. Erin, am I right that this was unanimous?
Correct, it was unanimous.
And basically, we have seen this bill in a very prescriptive manner in the past. This year is very general. The sponsor of the bill really worked hard in the interim to bring to the table the Health Facilities Association of Maryland, who are supporting it, and the Maryland Association for the Treatment of Opioid Dependence as well. They're supporting it, and they work together in drafting it. And I would like to just point the committee respectfully to the fiscal note, page 2, where it says, a small business effect, most healthcare programs and facilities are required to have a safety plan in place for another purpose. It is unlikely significant resources will be required for programs and facilities to meet the safety plan requirements under the bill. Likewise, since facilities are required to establish and implement a community relations plan only if required by an accreditation organization, significant resources will not be required for facilities to meet this requirement. It is also anticipated that significant resources will not be required for behavioral health program to submit their community relations plans to BHA. The only, in the bill, we received a letter actually from the Maryland Psychiatric Society and the Washington Psychiatric Society. And they are actually opposing it just basically because they feel their safety plan requirement reinforce negative stereotypes and may cause to liability. But, you know, that is really, it's a philosophical difference. Obviously, they're not going to come to the table. We discussed that regarding any possible amendment. And this is a clean way to do it. And again, they already are required to have these safety plans. Now they basically have to file it and let the it has to be available for the community. And that's it, pretty simple and straight. And I move the bill.
Second.
Is there any discussion on this bill? All those in favor say aye. All those opposed, no. The ayes have it. It appears to pass unanimously unless I see hands in the panel, which I do not. Senate Bill 120. Lisa.
This is a departmental bill. It adopts changes made to the National Association of Insurance Commissioners Credit for Reinsurance Model Law. The bill provides the authority for the Maryland Insurance Administration to adopt the NAIC term and universal life insurance reserve financing model regulation, which is an accreditation requirement by the NAIC for the state's continued accredited status. There are no amendments.
Delegate Cullison.
So this is a very technical bill related to how the Maryland Insurance Administration relates to the national certification processes. So I move the bill.
Any discussion? Is there a second?
Second.
Thank you. All those in favor say aye. All those opposed, no. Please raise your hand in the panel. I see no hands in the panel. Senate Bill 120 passes unanimously. Senate Bill 125, Tyler.
Senate Bill 125 extends the sunset date for the State Board of Chiropractic Examiners until July 1, 2032. Yes, my apologies, 2032. It was voted unanimously in Health Occupations.
Delegate Kelly.
Yes, we voted for this unanimously. There was a letter of opposition from the, get it right, Secular Maryland or something, but nobody thought that that was relevant to this. Yeah, they just think that the practice of chiropractic is in general too spiritual, which is, they're just opposed to chiropractic. So this is the issue that Delegate Shalega raised in the hearing, but made the point, and we discussed in the subcommittee, that this has been an established profession in Maryland for a long time. We're not going to go back now. So it was irrelevant to extending them. And it passed unanimously. Move the bill.
Okay.
Okay, I have a question. Now, when we move a sunset and we have no routine sunset or sunsets reviews going on in the interim, what happens? I know nothing will happen for 10 years, but what happens in year 10 now? Do you know?
I think we continue to do the extensions. It's unfortunate because we only had Senate hearings on these two, but I believe we continue to have a bill hearing on the extension without a sunset review report. I know, but then we can request the reviews as needed, which I think we need to be diligent about, as is apparent with the dental. So if we were to have, we don't have issues with the chiropractic board. They've been very good. But if we were to have them, we would want to utilize the ability to request the performance evaluation anytime during the 10-year period.
Knowing what we know now related to the dental board, I think maybe we ought to be rethinking the 10-year sunset, and maybe we need to reinstitute that. So let's talk about that in the interim. That said, this bill on its merits, it seems like fine. It seems like you did a good job. So it's been moved and seconded, I do believe. Is that accurate?
Yes.
Good. All those in favor say aye. All those opposed, please raise your hand in the panel. The bill passes unanimously, and we'll see what we can learn in the interim about reviews. Senate Bill 183. Tyler.
Senate Bill 183 is identical to House Bill 288 as it passed the House.
Where's Kipke?
Move the bill.
Second.
Kipke always did these identical
I
bills.
know.
That's right.
He was,
Get a word in.
I just want to ask you.
Okay. Is there any discussion? All those in favor say aye. All those opposed, no. The ayes have it. The bill passes unanimously. Senate Bill 192. Tyler.
Senate Bill 192 is identical to House Bill 5 as it passed the House.
move the bill.
Any discussion? Is there a second?
Second.
All those in favor say aye. All those opposed, no. Wait a minute. Yeah, the ayes have it. It's unanimous. I see no hands. Just double checking. Senate Bill 204. Lisa.
So there are amendments to this bill. But with the amendments, the bill is identical to its cross file.
Delegate Kelly, would you like to move the bill?
I think we need to move the amendments also. 'cause
I
it's
mean, yes,
subcommittee.
thank
Yes.
you.
So we'll move, this is the cross file to Delegate Belcastro's bill we passed a few weeks ago. So we'll move the amendments.
Second.
Any discussion? All those in favor say aye. All those opposed, no. The ayes have it. The bill
Move the bill as
passes.
amended.
Oh, yes,
Second.
thank you.
Second.
Discussion of the bill as amended.
Is that not back yet? This is it.
How could I hear Saab? I see you're muted, but I heard you.
You
Oh,
were
well.
muted.
You wasn't? Oh, okay. Okay, thank you. All those in favor say aye. All those opposed, no. The ayes have it. The bill passes unanimously. Senate Bill 212. Tyler.
Senate Bill 212 requires a notary public's seal to include the name of the county in which they reside or through which they are commissioned. It removes the term jurisdiction from the related statute, which the Secretary of State says was not intended to have been inserted through prior legislations, caused confusion over exactly what jurisdiction geographic body is supposed to be included in the seal. It was voted unanimously in Government Operations and Health Facility Subcommittee.
I want to ask a question.
Yes,
Delegate
this was
Rosenberg.
not controversial. If the notary public resides outside the state, the county in which the notary public was qualified would be listed and would move the bill unamended.
Second.
Is there
Madam
any
Chairman.
discussion on the bill? Delegate Saab.
Thank you, Madam Chairman. I'm just trying to figure out what's the reason for that. I mean, I used to be a notary and mine used to say when I originally got commissioned in Prince George County and then when I moved to Anne Arundel County, but my seal still said Prince George's County. So what's the purpose of having the county that the person resides in be on the seal? What does it make? Because you're commissioned by the state or by your state senator, rather.
Well, the bill as before us now does provide for flexibility in terms of if someone has moved outside the state. And so but that's what the bill does.
You moved out the county, not the state.
No. If you look at, the bill also provides that if the person resides outside the state, the county in which the notary public was qualified is what would be listed on the seal, on the stamp.
Okay. So as long as you live in the state of Maryland, your seal, you don't have to change your seal if you moved.
I don't, well, you
Let's hold,
have
let-
the jurisdiction.
what?
This bill eliminates having to have the jurisdiction,
Yeah.
but it would still
It
have
takes,
the county in which you reside if you live in the state.
I'm sorry, say that again. So what would my seal look like now? If I got commissioned originally in Prince George County and now I live in Anne Arundel County?
You must update it.
Okay. Thank you. Move the bill.
Second.
Tyler, do you remember the logical reason for needing to know the name of the county? I don't.
No, I don't remember that coming up in the conversation why the county was specified. I don't know if anyone else recalls that, or if you want, I can look into that, reach out to the Secretary of State's office and get back to you.
I don't have a problem with the bill. We can vote the bill and see what happens, but if anybody wants to hold it for clarification, because you did bring up the question, Delegate Saab in particular, I don't have a problem holding the bill till Friday when we're voting again.
No, that's fine. I just wanted to get clarification. I think it just makes it better, so that's fine.
Okay.
Thank you.
All those in favor say aye. All those opposed, no. The ayes have it. Put your hand up in the panel if you're a no. I see no hands. The bill passes unanimously. Senate Bill 247, Tyler.
Senate Bill 247 extends the sunset date of the Board of Podiatric Medical Examiners. It passed out of subcommittee unanimously.
Delegate Kelly,
Yes, same story. It was unanimous. Move the bill.
10 years.
Yeah.
Second.
All those in favor say aye. All those opposed, please raise your hand. The bill passes unanimously.
If I may add also, what I have been able to learn today about the new process is that, it really shifted around how DLS staff prioritizes these things. And they did hire, I think, at least one expert in doing these types of performance reviews. So, the purpose of the shift was to have a more efficient and effective use of time. So I do think that once we really get in the swing of using these performance evaluations, we will hopefully find them useful. So we'll focus on that this interim, figuring out how to maximize.
Okay. Good. Thank you. I know you will. Did I say the bill passed unanimously?
Yeah.
Good. Okay. Senate Bill 265, Tyler.
Senate Bill 265 is cross-filed with House Bill 301. As the subcommittee moved it with amendments, it conforms with how the House passed cross-file House Bill 301, which was voted out of the House. And so the committee would consider adopting the amendments to conform the bill and then vote on the bill if they choose.
Delegate Rosenberg.
Yes, the action on both the amendments and the bill was unanimous in the subcommittee because we're conforming it.
Oh, that's an anatomical gift.
And this is one where we wanted people to be more aware, both in making a decision and when they come to MVA.
Says, so Sarah.
Information is to be displayed regarding this option for someone. So first move the amendments to conform, the conforming amendments.
Is there a second?
Second.
Discussion? All those in favor say aye. All those opposed, raise your hand. There are no hands. The amendments pass unanimously.
Move the
Delegate
bill as
Rosenberg.
amended.
Second.
Discussion on the bill. All those in favor say aye. All those opposed, no. The bill passes unanimously.
Chairman Pendergrass, I'm on, so
Yay!
finally.
Was it about reinstalling Zoom on
Yeah,
your computer?
it was, my Zoom wasn't working, so I'm on and voting with you now. Thank you.
You're very welcome. We're glad to see you. Sorry you had so much trouble. Senate Bill 455, Tyler.
Senate Bill 455 is identical to House Bill 290 as it passed the House.
Move the bill.
Second.
Any discussion? All those in favor say aye. All those opposed, no. The ayes have it. I see no hands in the panel, which is really what I need to say. Bill passes unanimously. Senate Bill 500. Lisa.
This is the Psychology Interjurisdictional Compact. There is an amendment that makes it an emergency measure, and with the amendment, it is identical to its cross-file as it passed the House.
Move the amendment.
Delegate Kelly.
I concur with Delegate Kipke. Move the amendment. It was unanimous
Second.
for us.
Discussion? All those in favor say aye. All those opposed, no. The ayes have it. The
Move the
amendment
bill.
passes unanimously.
Second.
Second.
Oh, he's on it now.
Yeah.
You're focused. Okay. All those in favor say aye. All those opposed, no. Please raise your hand. The bill passes unanimously. We'll now move to Senate Bill 517. Tyler, you guys have really been busy.
Senate Bill 517 is identical to House Bill 210 as it passed the House.
Move the bill.
Second.
Any discussion? All those in favor say aye. All those opposed, no. The ayes have it. I don't see any hands. The bill passes unanimously. Senate Bill 537. Lisa.
This bill is identical to House Bill 420.
Move the bill.
Second.
Discussion? All those in favor say aye. All those opposed, no. The ayes have it. The bill passes unanimously. Senate
Did we
Bill
just
5.
how it undied? Isn't this the undead bill?
Yeah, so it was exactly as you said last time. There was some confusion in the Attorney General's office. They originally opposed the bill. There was some confusion about exactly what the bill did. They resubmitted a revised letter and supported the bill. The committee then reconsidered their vote and they voted favorable. What Delegate Shalega had looked at last time, they still had the original unfavorable vote posted. That's since been corrected. So there is now the favorable vote on the website.
Awesome. Thank you.
And did we just vote and have
Yes.
Okay, good. Thank you. Senate Bill 542. Aaron.
Senate Bill 542 is identical to its cross-file House Bill 673.
Move the bill.
Second.
Discussion. All those in favor say aye. All those opposed, no. Please raise your hand. The bill passes unanimously. Senate Bill 564. Tyler.
Senate Bill 564 is cross-filed with House Bill 871. The bill merges the Procurement Improvement Council and the Council for the Procurement of Health, Educational, and Social Services, and it requires the Procurement Improvement Council to hold a forum on notification requirements and compliance with those requirements on eMaryland Marketplace. The Senate bill differs slightly from how House Bill 871 was passed. It added a reporting requirement so that the Procurement Improvement Council would report on that forum on notifications and their recommendations based on that work in 2022. It moved favorably unanimously from the subcommittee.
Delegate Rosenberg.
We added the amendment. We amended the, so this is the Senate bill. We moved it unamended with the hope that the Senate would amend Delegate Charles's cross-file bill to conform it so that both bills would go upstairs. So move the bill. We moved the bill, even though it was different from the House bill, because we thought the notice involved with the Senate amendment, the reporting back to us on their work in 2022 was sound, no need for a conference committee. And so the motion now is for the bill, favorable on the bill, the Senate bill.
Is there a second?
Second.
Delegate, good. Delegate Charles, are you happy? Delegate Charles, are you happy? Delegate Charles?
Yes, I'm right here. Yeah. Can you
Okay,
hear me?
good. Yes, I know you have some pride in this bill appropriately, and I want to make sure you're good with this bill.
Yes.
Okay, all those in favor say aye. All those opposed, no. Please raise. Oh, are those questions you have or are those votes? Questions. I apologize. We'll go back to questions. I've got Delegate Krebs, then Delegate Saab in my panel.
Just quickly, I wanted to make sure that we got the House bill passed in the Senate. Is there any way we can leverage this to make sure both bills get passed? Not just the Senate bill. Just encourage them to pass our House bill and conform to their Senate bill.
That's the best thing.
Since this is it's our colleague's bill and he's the expert, and we need to make sure his bill gets passed too.
Well, you know, I don't have control over the Senate. I'm just going to say that.
I got a text from Senator Griffith and was told that the House bill actually passed.
Good.
So let me see. Stand by 1 second.
I can confirm Delegate Charles's report from Senator Griffith that passed unanimously in the Senate earlier today, it looks like.
Right.
Conform?
The amendment conforming to the what we are voting on currently.
Yes,
Good.
that is correct.
So this will smooth the way for them to both reach the governor's desk. All those in favor say aye. All up, Delegate Saab, your hand is up. I'm
No,
sorry.
I mean, Delegate Krebs brought up the same idea. I just want to make sure that Delegate Charles' bill is moving. Otherwise, I wanted to hold the other bill, but if both are moving, I'm fine. Thank you.
You're very welcome.
Krebs and
Nice
Delegate
to
Saab,
see.
appreciate it. And thank you, Madam Chair.
Nice to see you're all protecting Delegate Charles, although I think he could probably take care of himself. All those in favor say aye. All those opposed, no. Please raise your hand. I see no hands in the panel. The bill passes unanimously. Senate Bill 638. Lisa.
So this is the bill that would require the Maryland Insurance Commissioner to enforce a provision of law, the clean claims provisions against an ASO. There are amendments that conform it to the House bill as it passed the House.
Excellent. Delegate Cullison.
And with the amendments that passed unanimously out of the subcommittee, I would move the
Didn't
amendments.
go to subcommittee.
No, it didn't go?
No.
Wait a
Sorry.
minute. Because I had a discussion of 919. That's what. Oh, okay. I would move the amendments.
Second the amendment.
All those in favor say aye. All those opposed, no. The ayes have it. Would you like to move the bill, Delegate Cullison, as
Move the
amended?
bill
Oh,
as
wait,
amended.
wait. I see a Delegate Saab hand up there. Is that a hold up? Or do you have
Yeah,
more?
just a question. So so is this bill different than the House bill?
Yeah, the number.
Not with the
This bill
amendment.
to conform to the House bill as it passed the House.
Okay, thank you.
Okay, all those in favor, we're on the bill now, correct?
Yes, as amended.
Good. All those in favor say aye. All those opposed, no. The ayes have it. I see no hands in the panel. The bill passes unanimously in the same form that we passed our bill originally.
Unanimously.
Unanimously, right. Senate Bill 658, Tyler.
Senate Bill 658 is identical to House Bill 990 as it passed the House.
Move the bill.
Second.
Any discussion? All those in favor say aye. All those opposed, no. The ayes have it. The bill passes unanimously. Senate Bill 684, Tyler.
Senate Bill 684 is identical to House Bill 758 as it passed the House.
Move favorable.
Second.
Whatever.
Any discussion? All those in favor say aye. All those opposed, please raise your hand. The bill passes unanimously. Senate Bill 704, Lisa.
So we've actually already passed this bill, and it's sitting on the governor's desk. I'm not 100% sure how it ended up back on the voting list or how we could even vote on it again. So
We passed both the cross-file and the House bill because this is the Senate bill.
I know.
Yeah, that was
Okay.
my impression too when I saw it on the list. So I will back Lisa up on that one.
Excellent. Okay, Senate Bill 714, Tyler.
I did see a hand from Delegate Krebs. Is that on the prior bill or this one?
Did we skip 658? Or did I just miss it?
You missed it.
Okay, we did it. I'll just make sure. I don't have it marked down. Thank you.
It's easy to do. So Tyler, Senate Bill 714.
Senate Bill 714 is cross-filed with House Bill 989. It's similar to how, but there was an addition that the Senate added to the bill that would make a reporting requirement for the 911 board on the demographics of 911 specialists, salaries of specialists, and plans for implicit bias training for 911 specialists. And it was voted unanimously in the subcommittee.
If I may, I would yield the floor to Delegate Krebs, who spoke in favor of this amendment
You
before
may.
the subcommittee.
Thank you. I intended all along to have that amendment on there. It was my mistake that it didn't make it on the House bill. So, thank you for
Okay,
fixing
thank you
it.
for that
Move the
explanation.
amendment.
Second.
Is there discussion on the amendment?
I think we're on.
It's just the
All
bill
those in favor
as
say
printed
aye.
for
All
third
those
reader.
opposed, no,
Okay,
please raise your
sorry.
hand.
Sorry.
What?
There is no amendment. We're on.
There is no amendment. That's right.
Oh, it came over correctly. I see,
Mhm.
with the amendment on it. Thank you for the clarification. So how about moving the bill?
Move the bill.
Second.
Discussion on the bill. All those in favor say aye. All those opposed, no. The ayes have it. I see no hands in the panel. The bill passes unanimously. Senate Bill 857. Aaron.
If you don't mind, I actually need to hold this one till the next voting session because I realized it needs a small amendment.
It's fine. We will hold that bill and we are not doing anything else. Is that correct? I think it's Aaron that had this other issue with me.
It's me, yeah.
Okay, and we're holding that too. Okay, so we are done. For anybody who missed it at the beginning, we are going to be meeting to vote again on Friday. There will be a chairman's meeting probably at 4, schedule permitting, unless something surprises me. Hang on a minute. I've pinned. What is going on here? Okay. I was getting great big pictures of a person and everybody else was sort of off to the side. And I have to say that's a little closer than I needed to be to even the people I love the most. So we're going to vote tomorrow. The chairman's meeting will be before that. I don't think there will be too many things on the list, but who knows what we will accomplish. We really are getting a lot of stuff done, and thank you for that. Delegate Rosenberg.
You just said we're voting tomorrow, I believe.
I meant Friday.
Friday.
We are not voting tomorrow. Thank you for that. We are. I think that we can hold off another day to get everything from the week, and then Friday we can do it all, and it'll just get to the floor on Monday, and that should be fine. So I don't think we have any crises. I think next week we'll see all the crises. With that, the voting session is ended, and have a good evening, and I'll see you tomorrow, all of you. Bye.